As a nurse, I get to be the reason that that child smiles, or that child gets better, or that patient gets better and gets to go home. That's a reason I'm a nurse.
I want that patients, they feel they are not alone. And I want they feel that somebody cares.
So nurses are the reason for hope, because without hope, there's not a lot left in this world if you don't have hope.
From the emergency room to the recovery room, from the first breath of life to the last, nurses are the reason fears are calmed, hope is restored, and lives are saved.
What we do for our patients is we are there to hold their hands. We are there to laugh with them, cry with them, and we are there to answer questions when they're scared and they're not sure what's the next steps. You know, if we don't have the answers, we know who we can go to get them.
The most fulfilling part of my job would be the impact that I make on the patients and their families.
I want they feel and fulfill the whole person as an entity, from their hearts, from their souls, from their minds, from their body.
I also want them to know that I want to do everything I can to the best of my ability to provide the best care that I can for them to have the best results.
I think the most fulfilling part of being a nurse is that you actually touch a patient every single day. I knew that when I went home from every shift that I positively impacted the life of someone that's having most normally the worst day that they could imagine. So knowing that I gave them a little bit of peace and probably promoted their healing made it very fulfilling.
The most rewarding part of my job as being a nurse is taking care of kids. I love pediatrics. Being able to make that child smile, being able to make that child feel better is very heartwarming to me.
At Charleston Area Medical Center, nurses are the reason we can provide award-winning health care to our region.
Nursing, it is a hard job, I'm not going to lie. It is physically demanding, but it is the most rewarding job, profession that you will ever have.
It makes me feel good. I know I'm doing something to make a difference for people.
I'm a religious person, and I always think if I have these patients, it's for a reason. And I always in the morning I say, God, please give me the patients who need me. And that happens every day.
I have never had a day in my nursing career that I have not loved coming to work.
It's a very hard job. It's not a glamorous job, but it's a very rewarding job.
I wouldn't choose anything other than being a nurse, and I truly believe it was my calling.
We know that quality health care like this is only possible with quality nurses. At CAMC, we're committed to creating a culture driven by opportunity, collaboration, and nursing excellence.
I definitely take pride working at CAMC. You know, when people ask me where I work, you know, my chest swells up a little bit and say, well, I work at CAMC. I think very highly of this institution. They take care of you. There's no other place to work.
So we want to see how can we do it the best way for our patients and help you grow professionally. We have invested into our nurses because we know how important it is for them to continue to grow.
I do feel that CAMC supports nurses. They offer opportunities such as the career ladder to help advance pay and company advancement. There are lots of opportunities for nurses here at CAMC to go beyond the bedside if that's their wish, or to stay at the bedside if that's their wish.
We offer everything here at CAMC, whether it's little babies to geriatrics.
CAMC supports its nurses in multiple ways. The career ladder is an excellent example of how a new nurse can come in. You come in as a CLIN 1 and you can climb the ladder to a CLIN 4. It affords you opportunities to expand your education, to get a nice pay raise, and to help provide better quality care to your patients through unit-based projects and then institution-based projects as well. The nurse residency program is something that CAMC started many years ago. It's pretty unique to us the way that it's been structured. It's a 6-month-long program where a nurse starts on their unit and they're put with a preceptor and then a mentor, and then they're grown within that 6 months so that they can become proficient in the practice of nursing and in the care of their patients.
If someone was thinking about coming to work at CAMC, I would say, what are you waiting for? Come to CAMC and work with us. Let us show you what a great organization that this is to work for. This is a family organization that we want to continue to see grow, and we have so much pride in what we do. And so we would love to have you at CAMC.
Whether you're new to nursing or new to CAMC, we invite you to consider a career with us and take your place among the best in the region.